Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Jordan Armstrong, Chief Revenue Officer at ResultsCX. Jordan, welcome to the show.
Thanks so much, Matt. Great to be here.
So, Jordan, what I always like to do before getting into the main part of the conversation is give my guests a chance to provide more of an introduction in terms of who they are and what they do. So, Jordan, the floor is yours.
Yes, Matt, thank you so much. As you indicated, I am over at ResultsCX today, and over 50% of the practice that we have as it relates to consumer engagement today is really laser focused in on supporting our healthcare customers. The majority of those are the healthcare insurance organizations, but we also do work with some health service entities and some also on the provider and health system side of the house, and really just spent my career at different lenses and different walks of healthcare. Just starting with the original kind of footwork and around population health management. How could we really make sure that as that care was going out to the member, to the provider, or to the patient, that they had the correct tools that enabled them to make smart and educated healthcare decisions, and moving away from kind of that one-to-one approach, and how could we support that in a one-to-many approach from a population health management to where we are today is how can we leverage a lot of the phenomenal technology as it relates to not only data and analytics, but some of the new AI tools to provide a more robust experience to the healthcare consumer today.
And so before kind of digging into and picking some of those concepts apart, I always like to know what got you into healthcare in the first place.
Oh, geez. Well, gosh, we go way back to, like when you're young and in college and looking at, just kind of I always have had a strong interest in kind of the sciences and math. And I actually did start, in the back room of healthcare, doing bench research at Cincinnati's Children's Hospital. And so, from there, I realized that I was much better suited from my capabilities and strengths to spend time in front of kind of that healthcare consumer and the provider networks out there, and really pulling together strategies around how we could improve the overall healthcare experience. As I shared from multiple different lenses, is where I've had the great opportunity to spend my career.
So now kind of picking that up, when you're talking about that consumer experience and consumer engagement, what does that mean from your perspective?
Great question. We spent a lot of time talking to our customers about this, is, making sure that, they're taking a deliberate, and focused approach to how they touch their, albeit whether it's a member or a patient, depending on, where the outreach or where the interaction is coming from, and being really intentional about that and mapping that overall arching journey. And what are the unique and specific needs at the different phases and touch points of that journey? And then what is the appropriate touch? There's always a time and a place for that in-person interaction. When do we need to serve up digital tools and digital information, for them to interact with so that they can self-service? We then look at, even the back office of that is the financial experience from healthcare can be rather abrasive, the healthcare system within the U.S. has become overtly complex, a lot of individuals would say, and we haven't made it easy, for healthcare consumers to understand, the cost implications of care when they are in some of the more scary times of their life, either supporting a family member or for their own care. And so how can we reduce the potential points of abrasion throughout that journey by being laser focused and deliberate about how we touch the patients and members during their time of need.
As you're talking about the time of need and the complexities of insurance, which I think you touched on are certainly real and present, because it's I think most people have had that experience where you get some type of communication and just kind of throw your hands up in the air. So what are some of the approaches that you've seen that have successfully helped kind of clear away that fog and make it easier for the recipient of that information to get a positive aha moment?
That's a great question. There's a lot of different tools out there, from that perspective, and even just changing, right, how we engage with that consumer, that shift from, kind of that basic care to more the holistic care. So, right, instead of, kind of documenting and paying for clicks, versus right now, in a Medicare Advantage world, for example, right, really the financial models encourage the providers to provide that holistic care based on, right, the known risk of and the diagnosed diseases of that individual, and making sure, right, that they're rewarded for providing more of that holistic member experience, versus, right, kind of the clicks for care of the historical way, right, healthcare was accessed, within the United States today. And so making sure that, right, we make right, any communication that goes out to the patient, to the member, it's in plain language, right? Make it easy for them to understand. Give them multiple different tools, to help them understand, what their benefits are. So, for example, right, we've been using a lot of AI-based video technology to help communicate what we call ANOC, right, the annual notice of change of benefits, and helping our clients, right, leverage those type of tools that gives them, right, the agility that they need because of the multiple different, slices of, right, the benefit changes, so that they can create multiple videos at scale, but right, meet their consumer where they're at, and so those that, right, don't necessarily understand the written communication, right, changing the type of media as far as how they touch their populations.
You're just talking about use of AI tools. So it's, how have you seen those tools progress, and where are the benefits being seen? And then also, not to make it an overly complicated question, but what drawbacks have you seen arise, or what kind of points of caution do you have around use of AI?
Yeah, no, great question. And that's, I was going to say the $1 million question, but I think it's the tens of billions of dollars question, right? Healthcare is going to be really slow to adopt. Where we're using AI type technology today within how we service, right, our clients and their members, is how can we make it more efficient on the back end? So when our advocates and our associates are interacting with their members, with their patients, right, they can provide concise and easy to understand information back to the members, and then also giving them tools, right, that help guide kind of that next best action, depending, based on what is transpiring throughout that voice conversation or that chat conversation, based on that unique interaction, right? Using AI to help identify what would be the next probing question, or what would be the next, set of information that should be communicated to that healthcare consumer at that time. As it relates to actual, the healthcare of patients and members, right? There aren't a lot of use cases out there right now. Obviously, everyone is the fear of the risk of the unknown, and the machines, right, do and will continue, right? They hallucinate, and so any potential negative impact on, right, access to care or care in general is going to be negatively received from the market. And so I would say cautious optimism around how can we use the tools right at the right point, and at the right inflections, right, to really enhance that experience. And what I always talk to our teams about, and even our clients about, is that, right, it's never going to be, right, an AI only approach or an AI only interaction, right, with the healthcare consumer, is that it's always going to be an or. And so it needs to be, right, the human plus, right, the machine, and how can that combination of the two make it a better and enhancing experience.
Yeah, and kind of your description of where you're seeing beneficial uses really emphasize that point you just made of it's human plus. Because, if I'm interpreting what you said correctly, it really sounds like the AI tools are being utilized to complement and extend what an individual is able to do by, I think in your example, saying, prompting of based off of what is being heard, these are possible next actions, or feeding supplemental information based off of that interaction that then can be utilized. Or I suspect, maybe it's looked at it, the person receiving that looks at it and goes, not the right time, but at least gives you kind of a good little nudge in the back of your mind.
Exactly. Right. All laser focused in on enhancing that overall experience. So then when we're representing our clients out in the marketplace, right, we touch their consumers more than they do on any given day, month, and year. And so making sure that when they are interacting with our teams, right, they're an extension of the brand and the culture of the our clients. And so that's really important. Right. We would never want the machine, right, to create that standardized experience per se.
Right. Because I think that then goes back to one of your original points of you're trying to expand the one-to-one to a one-to-many, but even within that one-to-many, it sounds like still driving a personalized feel that doesn't feel like it's just a cookie cutter approach.
Exactly. Personalization is king. And so while we've seen just massive advancement in how health systems and payers use data today, and then derive insights from that data, I would say there's still a lot left to be desired. Is how can we further personalize that experience, right? And anticipate what the needs of the healthcare consumers are, based on all the plethora of data that's being gathered on any given day, on any given interaction. Really where our clients are struggling, is not only, there's so much noise in all that data and they can get to insights. But the key question is, then what do I do about it? What's the action I take based on these insights? And what do I pay? What's just noise and what is actionable from that perspective? And so really helping them sort through all of the noise and get to, based on what their strategic priorities are or what their challenges and market headwinds, tailwinds may be, mapping specifically to what actions should they take and when, based on kind of the desired outcome.
Yeah, and that's a great point because it's ultimately any business that is trying to be successful is trying to figure out how can we achieve our goals. And as you said, that means being able to ingest appropriate data and gather meaning from it, as opposed to just trying a scattershot approach where you hope something sticks.
Precisely.
Thinking about all of those different pieces, I know you said you focus a lot on insurance in assisting insurance companies. And you kind of mentioned Medicare Advantage in there, which is obviously a program that is growing in popularity. Why is that consumer engagement and that just member engagement so important to an MA plan?
Yeah, it's from that standpoint is obviously we're seeing CMS place additional regulatory pressure on how health plans service their populations and service the members. And so, the historical approaches of yesterday are not the ones that are going to work, I would say, first and foremost, for today. And there's increased scrutiny is probably an understatement in the sense of, they're having to look broader and wider around how they can better engage their members at the right points. And so historically, it was always focused in on picking up the phone, the telephonic outreach, let's send them mailings. MA plans are all about making sure we get those annual wellness visits. Hundreds of millions of calls go out every single year, following up with members, making sure that they get in early in the year for that annual wellness visit, because that really does set the clock, for the code capture, that then says, okay, based on the disease burden that this member has, this is the projected care that they're going to need, then subsequently, incentivizes the provider and the health systems to provide adequate care based on the holistic risk of that potential member. And so I would really just say, organizations are going to have to continue to get more and more creative around what that engagement strategy might look like. So, where are the opportunities to enhance digital engagement? My parents are very tech savvy, and well into their 70s from that standpoint. And so making sure that you give them multiple different forums for the engagement. How can you leverage mobile apps, SMS reminders, personalized emails, not the bulk emails that everyone that goes immediately into kind of the trash bucket, leveraging that multi-channel strategy. One of the ones that I'm surprised at, the success of it is really the use of behavioral nudges and gamification, So some of when we talk about behavioral nudges, they can just be really small rewards for completing various different health actions, right? Can you take your health risk assessment? How many times this month did you go to the gym, right? If you go to the gym 15 times this month, right, we'll give you a gym reimbursement credit, of $20 a month, right? Those small things, right? Seeing a great uptick as far as, right, that continuous engagement of the member throughout the plan year versus just that one and done. And then also bringing in gamification into that, right? We start talking about the wearable devices. Is that I don't have the statistic, but I wish I did. Like, how many of us wear, right, our smartwatches every day? And it's extend way beyond smartwatches, right? You see a lot of, actually, my parents wear the Oura Ring. A lot of people have, right, the glucose monitoring devices, not because of, right, that they've got diabetes, but more for a preventative, proactive approach to overall wellness. And so I think you'll see continued expansion into that area. And then as appropriate, based on kind of geographic dispersion, right? We're starting to see a lot of success from a community partnership standpoint, partnering with, right, the local organizations to offer kind of the community-based wellness programs to help them engage and, right, within their community and really resonate and connect to the day-to-day life of their populations.
Yeah, no, kind of a lot of interconnected points that you're raising, but it all comes back to how do you get the person to respond and engage with that communication that's going out. And for those of you just joining, I'm talking with Jordan Armstrong from ResultsCX. We started talking a lot about consumer engagement and what those concepts are, now kind of focusing on specific strategies in the Medicare Advantage market. And Jordan, you're talking about kind of that gamification aspect, and just the use of technology or devices among that targeted population. It seems like that is a growing shift that, at least from my perspective, seems commonsensical, because more people have used technology throughout their daily lives for a longer period of time, that it seems like it's getting to the point where you can't make that blanket statement of, oh, people of an older age are going to be tech adverse or technologically challenged. You really have to assume that everyone has a baseline literacy and ability to utilize.
Yeah, no, and so, right, if and even to that end, right, understanding, right, the digital literacy of, right, each particular member subsequently, and then how does that equate into, right, the healthcare literacy? Is that I would say Medicare Advantage has had a meaningful impact on overall healthcare literacy across the United States. It's become, right, just given, right, all of the advertising that goes out every single year as we lead into and throughout open enrollment period, which we're in right now, right, is that it's pushing for, right, a more educated consumer, and making sure, right, that the questions that we get, right, from a lot of the inbound calls that come to us, right, as we've got the licensed agent supporting, kind of the sales side of those plans, is that it's definitely a much more educated consumer, right? They're able to ask very detailed questions, not only about cost, right, because cost will remain king, really in this market, but detailed questions around, benefits, and not only benefits, but like the supplemental, right, the more, right, not your basic blocking and tackling, is what are kind of the key supplemental. Some of the plans this year, right, you'll see will laser focus in on net new benefits. There's plans out there that are on the market right now that focus in on chronic condition or specific chronic condition care. And so it's definitely a much more educated, right, interaction and healthcare consumer today than, where we were at even 5 years ago.
Yeah, and kind of to that point of focusing on net new benefits or understanding the rising level of both digital and health literacy, as you were mentioning, is that making it more challenging for the plans to fight for their market share, or is it just making it more challenging to just generally operate in the market?
Yeah, this year is going to be dynamic, right? We've got a lot of factors in play. We have an election next week. And so we are seeing delayed enrollment, I would say kind of universally across the board, as we're a few weeks into the open enrollment. But I think and there's fewer plans available out on the market across the board. But if we look at general plans only, right, overall reductions of 2%. And so there's a membership out there that, right, is going to have to find, net new, because, right, what they have today won't be an option for tomorrow. You're also seeing a number of the major carriers and even some of the smaller carriers focus in on those specialized D-SNP, C-SNP plans for the first, for the first time ever. Right now, the projections are saying they are right. We're expected to see continued growth in Medicare Advantage, probably not as exponential as we've seen in other years, but over half of, right, the Medicare eligible population today is on a Medicare Advantage plan, and we expect to see, depending on, right, who you pay, what you're reading, what you pay attention to, right. Some will say as much as, right, 6% growth, and then on a much more conservative side, right, we may only see a 1% uptick in overall Medicare Advantage, and so it will be really important, right, that the diversity of plan offerings becomes really important from a differentiation strategy. You're also going to see, right, the plans have been very targeted around, what are the good markets based on, right, the networks that they can acquire and offer to their populations. And then subsequently, right, the financial pressures are real, not only on the provider side, but on the plan side. And so where can they offer, right, plans where they can also be profitable and continue to offer those plans year over year. There's a lot of industry hype right now around a lot of the regulatory pressures out there. No hidden secret, right? The Medicare Stars ratings that came in of recent were the lowest that we've seen in a long time, right? There's legislation out there, right? Or a lot of those are, right? There's lawsuits, bidding. Elevance obviously won the lawsuit. And so it's definitely encouraged other payers out, to go fight that. But, right, their star ratings is core to, right, is core to their overall revenue. And even slight changes there have significant, impact in their overall revenue and subsequently how they can best service their members. And so member care, member engagement is at the center of everything that the plans are thinking about today.
Yeah, and kind of that point about the star ratings, it's, I think it's one of those things where when they're released, as you said, everyone pays attention. And then obviously, as you said, from the plan side, it has a pretty significant impact on their business. How does that factor into their communications to the members, though? Do the members pay attention to the star ratings, and does that influence what they're doing, or kind of how does that factor into that engagement piece?
Well, because, right, the star ratings are largely based on, right, how they're supporting their membership, how they're communicating to their membership, how they're servicing their membership. Right. I would say it's caused even a heightened focus on driving, right, and investing more in that overall member experience, so that when the member is interacting with the plan, right, they're getting accurate and concise information, but they're also walking away with a good experience, and, right, they're getting, right, timely responses, right, to, right, the questions that they have. And so it will continue to, I think you're going to even see, more engagement from that standpoint. On the flip side of that is, right, around care gaps and care gap, right, the plan's ability to adjust or to close, right, the known care gaps of their members is becoming even more crucial and even more important. And so you'll continue to see creative strategies around, how do they engage their members and make sure, right, where they've got, open risk, right, encouraging them to get right, the right preventative screening or the right proactive care or care for their chronic conditions, right? And so it's really now, right, an environment that's encouraging care versus, right, care avoidance, which we saw a lot of that through COVID.
Right. And kind of, I think that then feeds back into, as you said, being able to get appropriate data on all the members, so that can help, it sounds like, inform, how you do the ongoing engagement, as well as how you're kind of structuring the benefits and the opportunities for care that the plans are offering. So it's, are you seeing an evolution in how the plans are reaching out to the members to maybe gather new information, or asking, old questions in different ways to see if it generates different types of responses?
No, I would definitely say, right, we're seeing a lot of innovation, right, around how the plan, how they think about interacting with the member. seeing a lot of innovation as it relates specifically, right, to how they think about population health, how they think about care management, how can they, right, use, right, data, and not only the data, but predictive analytics to anticipate, right, care needs and, right, events within their population so that they can proactively, right, engage with that member. So, right, whether it's telehealth or remote patient monitoring, like we talked about, or all the way to really that need for personalized medicine. Right, those are some of the innovations that you're seeing from a an insurance carrier side. Really, and then also looking when we talk about the whole care, it's not necessarily only the medical is how are they thinking about addressing right the social determinants of health and and looking right for partnerships within the communities of the populations they serve, and making sure that they're integrating right the SDOH. Interventions and opportunities, like I'd like to say, into kind of that incorporated holistic health solution. Subsequently, right, then the member gets a higher level of care. Hopefully, right, that proactivity, right, decreases their overall healthcare risk, and then subsequently, right, that has a positive impact on their star ratings.
Yeah, and kind of, I think, as you just said, it all brings that full circle to the holistic care and the holistic approach, because it's, you're having to kind of utilize all available tools and resources and determine how best to be able to bring that all together. But Jordan, believe it or not, we're already almost at the end of our time. So I want to kind of use that to frame one final question to you, which is, what's your bold prediction for what will shake up either Medicare Advantage or that broader consumer member experience in the coming year?
I think 2025 and even into 2026 is there. I think what a lot of the industry is predicting is that there's going to be a major shakeup. Will we see a lot of it in 25, or will we not see it until 2026? Right. Who knows at this point, but I think what you're going to see as far as some of the kind of the impacts of what I think might happen is there's got to be that intentional focus on the hyper personalization of the member engagement and how we care for the members. I think one of the other interesting ideas that's out in the market right now is, will we start to see kind of a shift towards dynamic benefit structure versus where we were today? It's this is your plan, it's static, right? This is your plan, and your benefits remain the same throughout the year. And so there's a lot of discussion and hype in the industry around that. And then probably not an epiphany, but you're gonna continue to see the expansion into kind of the virtual world and the home-based care models, right? Bringing care to where into the comfort of where that patient wants to interact with the health system and also with their health insurance company. So I don't think anything groundbreaking, but this year will definitely continue to be dynamic as far as not only the open enrollment, but how Medicare Advantage plans look to engage with their members in a different way than they have historically to have greater impact.
Yeah, so even if those aren't necessarily, kind of breaking new territories, still a lot of potential shakeups and a lot to keep, an eye on. So thank you for the predictions. And as I said, believe it or not, we are already out of time. I want to thank my guest, Jordan Armstrong, for a great conversation today.
Well, thank you so much. It's been a sheer pleasure.
And thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.